So, Listeria monocytogenes is a gram-positive bacilli, and Streptococci is a cocci. So that's how you can differentiate. So, gram-positive bacilli, CSF, neonate, meningitis, Listeria monocytogenes. Remember, Listeria is a bacilli. This looks like a meningocele. Guess it is multifocal clonic. Okay. Answer is urine examination. Cytomegalovirus infection results in periventricular calcification. Urine and saliva are the best specimen for culture, while saliva and cord blood are the best for PCR in diagnosis. So urine is the best choice within 2 to 3 weeks. Definitive is PCR. John's syndrome. It should be number 4. Marclonic jerks on awakening, sleep deprivation. Answer is Sturge-Weber syndrome. Sturge-Weber syndrome's other name is encephalotrigeminal angiomatosis. Encephalotrigeminal angiomatosis is a phacomatosis characterized by facial port wine stains and plial angiomas. Most common childhood manifestation is childhood seizures, present in 90% of the cases. Begins in first few years of life and often associated with developmental delay and hemispheric symptoms including hemiplegia, hemiparesis, hemianopsia. Approximately a third of the patient have choroidal or scleral angiomatous involvement, which may be complicated by retinal detachment, ophthalmos, or glaucoma. Get the slide. Sturge-Weber syndrome, Portwell stain, tram track appearance, unilateral hemiparesis and everything, retardation, glaucoma, G-neck gene involvement, epilepsy, Weber, webs of capillaries in the brain, intracranial calcification. So Sturge, Weber syndrome, the mnemonic is Sturge, Portwine stain, tram track appearance, unilateral, retardation, glaucoma, gene involvement, epilepsy. Answer is muscular dystrophy. Calf pseudohypertrophy. Abnormal expansion of the calves by fibrofatty proliferation is a hallmark of Duchenne muscular dystrophy, the most prevalent kind of muscular dystrophy. This is a complete craniospinal rhichisis. Answer is radiotherapy. That is the incorrect approach. Radiotherapy is not given to children less than 3 years of age in the treatment of medulloblastoma. So, radiotherapy is not given to children less than 3 years of age in medulloblastoma, and here you can see the girl is only of 1.5-year-old. So, I'm suspecting some kind of bleed, right? Okay, no, it's something else. Go for Wilson's disease. Wilson's disease is an autosomal recessive mode of inheritance and is characterized by tremors, rigidity, skin. Face of a giant panda. This is Duchenne muscular dystrophy. Dystrophin deficiency. Answer is normal saline gauze. Meningomyelocele is a caudal neural tube defect which requires prompt and correct management from skill team in order to improve the chances of survival. Surgical correction should be performed within 48 hours of delivery, and the infant should be placed in prone position with a non-adherent sterile saline dressing and a plastic shield wrap in order to maintain moisture and protect the defect from drying, trauma, and infections. Normal saline gauze. Microcephaly seen. Answer is anencephaly. In this scan, the cranial vault is absent. So anything pointing to the head, you should be able to answer anencephaly. Duchenne muscular, no, it is viral myositis. It is not Duchenne because it doesn't appear at this age, 6-year-old, and the CK levels will be very high. Like in the previous question, it was a 8-year-old baby, and creatine values were rising with aging. So let's read this. Early childhood, 2 to 5 years of age. Grover's sign, sort of elevated CK enzymes, 10 to 100 times the normal range. Second one is the correct sentence. 10% of healthy people have elliptiform waves on EEG. Okay. In progressive multifocal leukoencephalopathy, waves are seen. Diffuse slow waves are seen on EEG. Let's guess. It is pyridoxine. So, vitamin deficiency, which can cause neonatal seizures, is pyridoxine because glutamate is a excitatory neurotransmitter, which increases the chance of seizures. It is metabolized by GABA. It is metabolized into GABA by GAD. Glutamate is made into GABA by GAD. GAD is your glutamic acid decarboxylase, glutamic acid decarboxylase. And the coenzyme for this is vitamin B6, which is your pyridoxine. So if pyridoxine is absent, GAD will not function, glutamyl will not convert to GABA, glutamyl will accumulate, causing seizures, neonatal seizures. Wound swab cycle and sensitivity. Guess vein of Gallen-Mark formation. Vein of Gallen-Mark formation will have bulging anterior fontanelle and bruit on auscultation. So, delayed neural migration and organization leads to certain disorders. Least likely possible is focal cortical dysplasia without balloon cells. Neural migration disorders are characterized by defective movements of neurons from the place of origin along the lining of the lateral ventricle to the eventual place of residence in the correct laminar position within the cerebral cortex. Types of neural migration disorders: schizencephaly, lesioncephaly, agyria, smooth brain, characterized by the absence of cerebral convolutions, pachygyria, polymicrogyria, and heterotopia. So, lesioncephaly, schizencephaly, polymicrogyria are all examples of non-migration, and lesioncephaly is your agyria or smooth brain. Mm, let's guess. So it is decorticate and decelerate posturing. It doesn't suggest brain death. This could be atypical absent seizure, juvenile myoclonic epilepsy. Correct answer is juvenile myoclonic epilepsy. Whenever there is a sibling, answer juvenile myoclonic epilepsy. ACTH. So, ACTH is given because the epilepsy is related to cause cortisol releasing hormone. So, answer is West syndrome. They do not have postictal deficits. Periventricular leukomalacia. It is due to birth asphyxia. What will be a finding of child with spastic diplegia? First of all, spastic diplegia, your cause is hypoxia. And you see periventricular leukomalacia. Answer is trofinetide. So trofinetide is analog of insulin like growth factor 1 and helps in Rett syndrome. Trofinetide. Answer is Hurler's syndrome. There is a Hurler syndrome child. HS megali. And they have copious nasal discharge. Remember, one would not like to care for a Hurler syndrome child. Ornithine transcarbamylase. Beta oxidation of fatty acids. Ray's syndrome. Widespread mitochondrial dysfunction, particularly defective beta oxidation of fatty acids. That is your question. Ray's syndrome, ray of sunshine. S is for steatosis of liver, hepatocytes. H is for hypoglycemia or hepatomegaly. I is for infection, chickenpox, influenza. N is for not awake, comma. E is for encephalopathy. Widespread mitochondrial dysfunction, no beta oxidation of fatty acids can cause steatosis in the liver. Von Gerke's disease. Whenever there is who gets tired after exercise, it the kid's name is Von Gerke. Anyone getting hypoglycemia after moderate exertion is Von Gerke's. The kid's name is Von Gerke's, remember. There is also enlarged liver and kidneys.